And it goes a little something like
Good day! My name is Natasha Alexis Morelos, a BPED 1D student, and this video presentation will show you the process and analysis of the exercise called pigeon. What is pigeon exercise? The pigeon pose is one of the most popular yoga poses, and it helps release tension points and improve the range of motion in the hip joints. Pigeon pose, formerly known as Kapotasana in Sanskrit, that stretches your hips and lower back. This pose requires particularly high mobility in the hip joint. Practitioners with a suitable natural structure and unusual flexibility can do it relatively. It can be a great way to increase flexibility and stretch your muscles. It is important to perform the move correctly to prevent injury or strain. In most cases, the hip joint structure does not allow the femur to use the entire rotation range and creates a break. Unsuitable or too aggressive practice can cause severe damage to the knee joint. Start on all fours and bring one leg forward with the knee between your hands. The front knee is bent in the sagittal plane. Take the foot away from the thigh to open the knee angle while keeping the pelvis centered. Notice how it creates rotation in the hip joint and knee joints. The ankle is straight in plantar flexion. In this position, the chest faces forward. The hands are placed on the floor to the sides of the knee. Inhale, exhale, and descend slightly with the pelvis in the center without collapsing to one side. Slide the hands forward on the floor and rest your forehead between the hands. The articulating bones for knee are femur, patella, tibia, and fibula. The movement pattern for right knee is flexion and extension for the left knee, and the hip rotates laterally. The articulating bones for hips are femur and pelvis. The movement pattern of hips is hyperextension. The articulating bones for shoulder is clavicle and scapula. The movement pattern of shoulder is flexion. The articulating bones for ankle is tibia, fibula, and talus. The movement pattern of right ankle is in dorsiflexion and the left ankle is in plantar flexion.